So what you're saying is like, if you have a kid that struggles with bedwetting or has behavioral issues, it could be coming from their mouth.
Totally. So many kids that have like these ADHD symptoms. And, I see a lot of these kids and I'm looking at their health history and they're on all kinds of medications to treat the symptoms. But really what's going on is they have an airway problem, apnea. They got these underdeveloped jaws. There's even a correlation between bedwetting. Kids that are apnea, they have a hard time getting oxygen to their brain. And if I'm not getting the oxygen that I need when I'm sleeping, I'm not going to be well rested. My brain is going to be not working the way that it should. I can't keep my attention or focus. So rather than giving the kid Ritalin, we just need to figure out how to get the kid air. They just need oxygen. You shouldn't ignore the symptoms that your body is telling you. When you have a toothache or you have bad breath, there's something going on there, and your body's actually very smart. It'll tell you when something's going on.
Dr. Alan Curtis. Is that a good intro?
Yeah, that's great.
Dr. Alan Curtis. Orthodontist friend. Welcome to the Generational Health Podcast.
Excited to be with you.
Yeah, thanks for coming in, man. I thought that you would be really fun to talk to, which we have talked before. We were actually in your office because you were working on 2 of my kids' braces, one of which hopefully we'll get those off soon.
We were talking today. We're going to make it happen.
Yeah, my wife's trying to get you to take those things off before we leave on a little summer trip. So. But you and I just started talking. I thought, man, this would be awesome to have you come in here because there's so many, like, as we talk about longevity and we talk about trying to optimize health, I think that oral health gets overlooked. I don't know, maybe you can correct me if I'm wrong, but it doesn't feel like it comes up very much with pediatricians. We have great pediatricians that we've worked with our kids. But oral health isn't really something that I think they sort of just leave it up to the dentist and to the orthodontist to have those conversations. But it's going to be really interesting to dive into that a little bit with you and get a feel for how that affects lots of different things with our kids and even with ourselves.
Totally.
With oral health. And there's kind of just a lot of new data coming out with fluoride and what's in our water, how that might be affecting us, maybe some misconceptions around soda and what that's doing to our teeth and flossing, and any of that I think could be really interesting. But before we dive in, would love to know a little bit about who you are. So if you give like just a quick intro, who's Alan Curtis?
Sure, you bet. So I'm actually a 2nd generation dentist. My dad was an orthodontist growing up, and in school I loved everything studying, but I really enjoyed the sciences. And so it just seemed like a natural thing. As I grew up, I thought, this would really be a great thing. And I didn't realize how great it would be to be an orthodontist. So I went to Brigham Young University for undergrad, studied zoology. We might talk about that a little bit today, but emphasis in evolution and biology and stuff like that. And then I went to UCLA for dental school and became a dentist. And then after you become a dentist, you can specialize. And I became an orthodontist. So I went to Texas A&M in Dallas and became an orthodontist. So with that orthodontic degree, I got a master's in oral biology. So all things scientific about the mouth and how it relates to the rest of the body.
I just got the chills. Do you want to know why? Did you know I went to Texas A&M?
Yeah.
Have we already made this connection?
Well, Steph and I have talked about it a little bit.
Dang.
A&M.
Fighting Texas Aggies.
That's right.
All right. Well, that's great. So would you say you went into dentistry because of your dad? Or?
Totally. Yeah. I feel like you can't do something as a career unless you've seen it. And I wish my kids would like shadow a lot more careers, professions, and so they kind of know. I mean, I was lucky that I feel like I was born literally into a great career, and my dad didn't hand me the business, but I had to see it in order to know that I'm gonna dedicate 12 years of college and then have a career at the end of it. So it was awesome to be able to luck out on that. We talk about privilege, and I feel very privileged to have been able to go to school and learn a trade, something that's useful to people and help them with their wellness. And I love what I do every day. I mean, there's people I tell my kids, like, there's the Sunday night test. Like, Sunday night, you have to go to work tomorrow. Are you excited to go to work? Are you dreading going to work? And being able to help people with their problems in a way that's rewarding, both, financially, but more importantly, like developing relationships with people like your family, and going to work each Monday morning is not a drag for me because I love what I do.
That's awesome. Most people probably find going to work a bit of a drag. So if you can find something you love doing like that, that's amazing. Curious, like, what's your favorite thing about being an orthodontist? You say it's like super rewarding. You love it. Like, what is it that like you love doing the most?
Well, I love taking people's braces off. I love the end result. Like, if I was pushing around paper, no offense to people who do that, but if I was pushing around paper and I got to the end of my month or my quarter or my year and I thought, oh, what did I do? And I helped a spreadsheet change some numbers, that'd be hard for me. But like, when I take someone's braces off, I tell people it's like Christmas morning. It's like unwrapping a package, and we look back together at what they used to look like and how we've changed, their smile. Smile is some of it, but also just confidence and their ability to feel good,
Yeah.
So that's really exciting for me.
That's awesome. And you have a passion for photography. I know this only because I've been around you enough to see you always have, like, you're always capturing stuff. I got to imagine in what you do, I mean, you're always taking images, and that maybe there's something there too, where you have this like drive. You really enjoy like seeing something, and then I don't know. Sometimes I look at dentists and orthodontists, specifically orthodontists like you, and you're kind of an artist, right? It's like you probably like you take this photo and you see something, but you know what it could be,
right? And
so it's like probably this cool challenge that you get to take on, and then when you take it off, you get to see like this masterpiece. And
in junior high, we had, I don't know if you had shop class when you were growing up, but we had shop class, and I just remember Mr. Bond, if he's out there, he's awesome. Like, we would take wood and we'd build stuff, and you'd polish it and you'd shine it, and like dentistry is kind of, in some bad ways and in some good ways, it's carpentry in the mouth. It's like taking what you've got and turning it into something beautiful. Photography is cool because you can scratch the creative itch and you can take some cool pictures. But being able to create something, I think that goes back to just being able to make something and look back and go, oh, that's pretty, or that's good looking.
So I would say most people probably come and see an orthodontist like yourself because of the image aspect. They want, they see crooked teeth and they want to look better. It's the cosmetic side. Yeah. But one thing I'm really interested in learning about today is that crooked teeth aren't necessarily just a cosmetic thing, right? No. What signals are crooked teeth potentially telling parents about their kids?
So it depends on their age, developmentally, there's a normal progression from a newborn baby to a fully formed adult. And as they, travel through that normal development, some kids will deviate from what is the normal development. And as an orthodontist, I typically see kids at 7, 8, or 9 years old, as their first visit. And sometimes I will see severe breathing problems. Airway is a big problem that causes deformities of the mouth. So it's a form follows function. In other words, whatever they're doing, and whether it's nutritive, where they're eating, how they're suckling, when they're newborns, how they're breathing, it will change the way the face develops. And so if it's developing normally the way that it should, then their eating and their breathing will be great. But if they're not eating well, then it's going to affect their whole body. If they're not breathing well, then it's going to affect their whole body. And so the body will morph and change in a way that optimizes their health and their wellness. I mean, it's pretty interesting to see the on the extremes of the bell curve when it's not going well.
Yeah. So when I was kind of preparing for our conversation, I don't know a lot about orthodontics, so it was a bit foreign for me.
Yeah.
But the term that came up constantly was oral function. It seems to be like someone with poor oral function seems to be those with maybe like, so crooked teeth that may end up or jaw that ends up restricting airways, right? That can create neurological issues, breathing problems. So that would all kind of fall into that oral function, right?
Totally. Yeah.
Okay. Yeah. So I'm curious, like, as we think about this from in terms of overall health of a child, you talked about how like a restricted airway can change a lot about like these kids. So when they come in to you with crooked teeth, again, it's all mostly cosmetic, but what are some of the underlying issues that, like, if someone delays fixing that or they never do fix some of those oral function problems, what are some of the bigger issues that can start to happen within a kid, adolescent, and into adulthood?
Yeah, great question. So airway, getting oxygen to your brain, and then being able to get proper food, nutrition. So, we talked a little bit about what can the healthcare system do better. I do feel like in the hospital, if I don't know if they call them nipple Nazis anymore, but a lactation consultant will come in and say, "Hey, how's this baby feeding? We need to get this baby fed." And so if a child if they're tongue tied, if they can't swallow the right way, I think we do pretty good at the newborns identifying cleft lip and palate. I mean, when my wife went in and we did ultrasounds with the OB and the pediatrician, they were checking for cleft lip and palate. So I do think we do pretty well at the first, few weeks of identifying things that are difficult. But then from there to age 10, it's like there's this wasteland. They're at the pediatrician. The pediatrician isn't necessarily talking about oral wellness. And then I think people think of baby teeth like, oh, they're just the trial teeth. And so a lot of people will never even go to the dentist until they have their first toothache, or they're starting to see the teeth growing in the second row. And so there's a big gap of care from the oral development that I think parents should really be aware of. And so that would be getting them into the pediatric dentist. Just so that they have a good experience and they can screen for things like sucking on fingers and tongue thrusting and things like that, which all can affect their breathing, and it can affect the shape of their mouth as they get older.
So there's some parents that use binkies for a long time.
Yeah.
And I've heard lots of different opinions about this, but just curious on your opinion. At what point should the binky stop? And if a binky use is used too long, what would you say are the biggest risks of that? Yeah.
The binky really is just an artificial tit. I mean, frankly, and I'm serious. And so there is a before the binky was invented. Okay, think about cavemen. There was a time when it was, you're hungry, your body's saying, hey, it's time to eat. Let's bring the baby to the breast. And I think when we figured out, hey, I can substitute the real thing for something that will create we talked about hormones here, but like we create a dopamine hit for our kids. So you put that binky in the kid's mouth and they're fussy, you're going to instantly stimulate the glands of the hormones to like, hey, I'm comforted. And so I feel like in today's society, we do that a lot. We find artificial chemicals or artificial ways to stimulate the natural feeling of wellness. And if we could get back to the natural way of stimulating that wellness, feed the kid and get connection with their parent, that's how it should be. Now, I'm not totally anti-binky. I mean, if you're sitting in church and the kid's screaming and you want to put the plug in, it's, that's understandable. But I also see that also today in parenting where it's a digital binky. Let's put the iPad in front of the kid and they'll stimulate that dopamine, they'll calm down. But when you put in these artificial ways of doing something that otherwise was natural, I think it can mess us up. And so back to the binky, I think the binky, if your child is too old to be breastfeeding, they're probably too old to have the binky in their mouth. So I see 3-year-olds, 4-year-olds, 6-year-olds, and I don't know the statistics because I'm not a lactation specialist, but I don't know that there's there's a certain age where they'd start to scratch your head if you saw a kid nursing at a certain age. But we don't have that same stigma for the binky. So the binky's out and they're using it. But a little bit, my kids all have used pacifiers, but they all dropped it pretty quick. It wasn't something that was needed to give them a sense of wellness or help them sleep or, I don't know if that answers your question, but.
Yeah. So I have 5 kids and they all went through their binky phases, some longer than others. We, had different ways of getting them to, what's the right word? Part from their binky, which was really kind of tragic in some circumstances. Yeah. I think with our youngest, I can't remember if it was Keller, where we took him to the store and let him pick out whatever he wanted from the toy section, but he had to leave his binky there. And that was where he said goodbye.
Yeah.
He said goodbye to that binky because he was kind of addicted to it. To your point, a dopamine hit.
Yeah.
And, or whatever it is that triggers that response of comfort. And he left it there. And in his mind, he thought, okay, I'm willing to make this trade-off.
Yeah.
And he was fine after that.
But it's cool that there was like a ceremony. I've seen parents tie it to a bouquet of balloons and they just
let it go.
And it's like, hey, it's not coming back. And you made the trade and
do what you got to do.
We shook on it. And
but the reason we did it was really because as a parent, we were concerned about how it would shape their mouth, right? You see some kids so my youngest, Benny, his mouth, you could see his front teeth really start to round out in the front.
Yeah.
And you worry about lisps and other things like that. So I'm curious, if someone has it too long and can all that stuff be fixed? Are there potential long-term issues if someone does it too long, how it shapes the roof of their mouth?
Totally. So back to the point of, it's a mimic for feeding. You wouldn't feed for hours and hours on end. You would have a feeding session and then it would be over and then you go back. But if you put a binky in and it's in for hours and hours and hours and hours and hours, that can really reshape the bones of the face. So when a baby's born, let's say it's a traditional vaginal birth and the kid, comes out, their heads sometimes are kind of funky shaped. And you'll see parents go to the pediatrician and they'll put these white helmets on to kind of reshape the bones of their face. Well, our bones are so soft and tender at that age that if you put something in there that is on there for hours and hours and hours, you can really deform, and not in a good way, the jaw bones. And so then we see these deformations. And what happens is sometimes when the binky is lost, then they'll substitute it for their finger. And then their finger's with them everywhere, and it's a comfort. They're trying to get that dopamine hit or whatever the biochemical stimulus is that's simulating the nutritive feeding that's good and normal and healthy. But that goes on, and then they're deformed. The other thing that happens is children swallow differently when they're young versus when they're eating normal foods. So a child who's suckling and nutritive nursing, they'll kind of swallow like this. And it's a tongue thrust. And that's a normal way that we all swallowed when we had our bottle. But people who persist with the binky or the thumb, they keep swallowing like that. So I've seen 30-year-old men and women who are still swallowing like this. And it's because they never let the binky go. They never did the trade and they just think, oh, everybody swallows like that.
Yeah.
And so then in their 30s and 40s, those bones of their face have solidified in that new position. And then the only way to correct it is now with jaw surgery, break the bones of the face. And so that's kind of tragic. So back to the early intervention is if you can let the kids hit the normal milestones as they grow and develop, then you can avoid expensive and painful things to correct the malformations that were created by things that shouldn't have been done, that are unnatural.
Mm-hmm. So I'm curious, as we talk about kind of like that bone size and all that, it feels like with my kids, even just from the time I had braces, they're starting a lot younger too. What's the reason behind that? Is it a difference in the actual like facial structure of kids these days, or is it just better orthodontic medicine to do it sooner and go through these different phases than it was maybe 20, 30 years ago?
Yeah, I think that it's twofold. I think the awareness of parents, knowing that, hey, I can identify, I see other kids with braces at younger ages, and they're like, I wonder if my kid has a problem. And so there's just a consumer-led demand of, hey, I should probably get this checked out. Bones still grow the same way they did, 20, 30 years ago, but a consumer's awareness of, hey, I should probably have this checked out. The other thing that I would say is the affluence of the average family. I think of people, if maybe they did see a problem in the 70s and 80s, and if it's just like, hey, if the family doesn't have money for food and for the basic necessities, why are we going to go work on something that is perceived by the public as a luxury? But I think you would say the same thing for going to the pediatrician. I think there's a fair number of people that would never take their kid to the pediatrician until they had a problem, or until the sports league said we need to have a paper signed as a physical. But I think as parents are becoming more aware, social media is great, but also affluence. People are like, oh, I've got an insurance benefit, I'm going to go see the pediatrician just for my annual checkups. And I think hopefully the orthodontist as well, same thing. It's like, oh, we've got this insurance, and I see other kids at back to school night have braces. Let's go get that checked out. Mm-hmm. And I think that's a great thing. I do think that there are some orthodontists that take advantage of that, and they do things that aren't necessary. If your kid is normal after you go visit the orthodontist shouldn't be doing anything. But if they see something that's outside of the range of what's normal, a good orthodontist will say, hey, here's a problem I see. Here's the consequences of that problem. Let's fix it while the bones are soft and tender now, or let's wait till you're more mature. You've lost all your baby teeth, and let's do it all later in one phase later. Yeah.
And some of it is cosmetic. I mean, if you can afford it, I mean, there are some kids, mine is one of them, that I can't, not actually saying I can afford it, but where you've given choice, right? Where you're like, this isn't necessarily like needed, but if you wanted to do it, here's a small thing we could do. It wouldn't be crazy expensive, but would probably make him feel a lot more confident at school.
Totally.
Like maybe just with his front couple of teeth until he's ready for a full set of braces, something that it's kind of like middle of the road stuff cosmetically, because that is a big part of it too. Like these kids, I don't know what it is, but like our mouths are just different now too. And maybe we hit on that, is just like the crowding problem. Like my kids are having I swear one of them had an extra tooth or something. And like, you couldn't even do his whole mouth because he had to pull a tooth to create more space. So that being said, even just the crowding itself, it's going to create a lot of insecurities in kids if they're all. And so it was really cool that you kind of found this, hey, we don't need to do full blown braces, but maybe we can do a couple little cosmetic things now so he can get through these kind of sensitive, years with friends and not feel like he doesn't want to smile, which I think is cool too. There's kind of a balance there. But going back to cost, I was curious, is the system set up in a way right now that, because there's more to orthodontics than, is it orthodontics or orthodontia? Yeah. I've heard both.
Both are appropriate. Orthodontia is an older term, but it's totally valid.
I swear my dad says that. That's why.
Yeah. But orthodontics is...
He works in the industry. So anyway, within orthodontics, it's more important than just the cosmetic piece, as we established. It can hit it can affect your ability to breathe, which then is obviously going to affect your heart, cardiovascular system. It's going to affect probably the bacteria in your mouth, which then is going to affect your gut bacteria. It's going to affect your neurological system. There's all these other parts of orthodontics, which is outside of that cosmetic piece. That being said, it's still very much seen as kind of a cosmetic thing and like a luxury.
Yeah.
Insurance is case in point because they don't pay for much of it. So I'm curious, like what types of advice would you have for those that feel like they can't afford it, but they feel like they really need it? Like, are there resources out there?
Totally. So I think back to the screening of what is normal and what is not normal. Most orthodontists, I don't know the statistics, but most orthodontists in the United States do free consultations. You can go to an orthodontist and have an evaluation, pretty thorough. I mean, they're going to check airway, they're going to check missing teeth, extra teeth, and that's completely free. A lot of orthodontists are sad about that trend is free. I think it's great. I think that you develop these relationships, and at those appointments, parents are educated. Why is thumb sucking so bad? Why is having a binky for so long bad? Why is my kids grinding their teeth? Why is that bad? I think that's amazing, and I wish more people would take advantage of that. Just like, hey, I'm not here to buy braces. I'm not here for you to do anything, but I want a wellness checkup like you would at the pediatrician. Just go and say, hey, here's where you are on the growth chart. Here's your height. Here's your weight. You're doing great, kiddo. You're in the 90th percentile. You're in the 60th percent. You're doing great. And you go to the pediatrician, that's not free. But at most orthodontic offices, it's free. And so if you go and you get a good clean bill of health, a good orthodontist will say, hey, here's some things that I see that are outside the realm of ideal. These things we need to fix now, and these things we'll fix when you're 12 or 13. But that triage of here's you and here's where you need to be, I mean, that's free. And so, but to your question, I think some parents confuse going to the orthodontist with going to get braces. And I think those need to be separated. And I think even dentists have a problem referring to the orthodontist. They think, I'm not going to send the mom and dad and kid to the orthodontist until they're ready for braces. And I'd say, well, that's like saying, hey, I'm not going to go to the OB until I'm ready to give birth. Like, that would be way too late. You got to develop that relationship and see that things are tracking and progressing.
No, I think that's awesome, actually. And I can say with you, we've experienced it in reverse, where we've had our kids go to you for a wellness check, if you will, at a pretty young age to check them out. And you have referred us to a pediatric dentist with some recommendations on what he should do to prep for orthodontic treatments down the road. But things that you're able to see, and I like that because it's more of like a teamwork with these kids, where it's just like, hey, there's going to be a time and a place for that, but it's different. Like, dentists are doing different things than orthodontists are. And so it was, I don't know, I just recognized that that's actually how it has worked with us is kind of seeing you and having a wellness check to see if everything is like, how misaligned certain things are. Cause all my kids are different. Their mouths are all totally different.
Same mom and dad,
same foods, same all of it. But some, their jaws are a little off. Some are twisted. Some are like just actually doing it. Like, I've got one kid that's like actually pretty straight. And another one, it's just like everything is like, seems centered, but the teeth are like this, So all of them are a little bit different, but I like how you just liken that to a wellness check for your mouth, which is really pretty cool. So any thoughts around like advice you'd have for parents if they've got young kids with permanent teeth that are starting to come in, at what age they should go have that wellness check? Yeah.
So our National Association of Orthodontists recommends age 7. And I think that's a great first, second grade, go in, kind of check things out. You're starting to lose your baby teeth at that point. The bones are still soft and tender enough that if there's some orthopedic correction where you're going to shape and mold the jaw bones, you can get that done at that age. And then just go get a a checkup, get a wellness visit. And then, like I said, if you find a great orthodontist that you can trust, they're not going to be gluing stuff in your mouth. They're not going to be taking money from you until there's something that is justifiable in doing it.
Right.
And which I think this is appropriate time to talk about it, but the cost of education is going so high for people going to medical school and dental school that unfortunately I find a lot of colleagues that are like, hey, I've got this family in front of me. I need to figure out something to charge them in order to pay for my school debt. And so that's where where it gets muddied, where there's a conflict of interest. My wife went to the dermatologist this week. She had a little something on her lip and the doctor was new. And she said, well, that probably is going to clear up, but if you want, we can do a steroid injection in your lip. And my wife said, well, are you recommending I put a steroid injection in my lip? And they said, well, it can't hurt. And so there was this, and then I said to my wife, I said, well, if you don't know that the doctor has your best interest in mind, then there are times where there's a conflict of interest and you need to be aware of the ethical problems that some doctors will get into. So some orthodontists, when you see them at 7 or 8 or 9 years old, they're going to be looking, what can I do? What can I charge? What gadget or gizmo can I put in the mouth, even if it's not necessary? But if you have a good provider who has your best interest in mind, they'll tell you what's normal, what's abnormal. And if something's abnormal, it doesn't mean that you have to fix it right away as soon as you see it. You might say, hey, this is abnormal. You got an extra tooth, you got a missing tooth, you got an open bite or a jaw that's off. Hey, let's take care of that when the kid's a little bit more mature, both physically and emotionally.
So I think it's the tricky part of that is knowing which ones that are good and which ones might not have, they might have a conflict of interest. And, you guys are all business owners and you got to pay your employees and you got to keep the business open and you got to make money too.
Right.
But there's kind of that, there's that line there too of, hey, is this medically necessary or is this, so I'm curious, what questions should parents be asking? So if they're in there trying to figure that out and trying to figure out, okay, is this the right time or are they trying to sell me on something? Like what questions should they be asking?
The single biggest one for me is, does the doctor own the business? So oftentimes there's doctors that come out of school and they have a ton of debt. They can't afford to start their own clinic or business. And they go work for a corporation that has the bottom line profit be their number one concern. This dermatologist that my wife saw was not the owner of the practice. And so they got some pressure from their business owner. So that's one aspect of it is the doctor's name on the door. Is the doctor going to be gone tomorrow if you start braces with this? Is there going to be another doctor that provides it? Another one would be just, hey, how do you feel? How does the person connect with you? Do you get the sense that they care about the whole wellness of the patient, not just, hey, you want me to close that gap? I'm a technician who's going to do that. So they've got to think holistically about your child's wellness. My mom, she's in her 80s and she goes to lots of different doctors and she'll share stories with me about her doctors. And she'll say, this doctor recommended X, Y, and Z. And what do you think about this? And I said, well, Mom, do you trust the doctor? And she's like, well, yeah, kind of, sort of, I think. And I'm like, well, if you don't trust the doctor, it doesn't matter what he tells you. So you should find doctors that care about you, that you get a general good sense that you like them and that you can trust their advice. And then frankly, you should do your own research, but do what the professional has. And my mom is interesting. I love her to death, but she just doesn't trust any doctor that she ever goes to. And I don't think that's healthy either, because your Google search or your Chat GPT search isn't always going to steer you in the right way. That doesn't say don't self-educate, but it does say you need to find a professional that you trust and cares about you more than just the dollar.
So I'm curious if we shift a little bit from like orthodontics into like traditional dentistry.
Yeah.
What would you say are some of the, I mean, maybe just you probably saw a lot early on. I'm assuming during school, you probably worked in some clinics, I'd guess.
Yeah.
You said you went to school at USC.
Yeah. UCLA.
UCLA.
Those are arch rivals.
Arch rivals. I'm so sorry. But did you work in did you have to do like volunteer type work?
Yeah.
I'm curious, what are some of the things that you see in people with really poor hygiene, oral mouth hygiene? How does that affect their physical health? Like if you got someone that's you can just see they've got cavities, they might need root canals, they got infection in there. How does that affect the rest of the system?
Totally. So, we have natural bacteria in our mouths, and that's healthy. It's actually good. Mouth, your whole digestive tract. So in your stomach, if you didn't have the proper bacteria in your stomach, it would not be good. So the astronauts who are coming back from space and they've been in these sterile environments, they've found that they've had problems with their digestion because they don't have adequate bacteria to help them process and be healthy and well. In these clinics that I went to where people were just in really bad shape, is the amount of bad bacteria in their mouth was just skyrocketing. So having bacteria in your body isn't necessarily an infection, but when the quantity and type of that bacteria gets out of whack, then that creates symptoms of inflammation. It creates symptoms in your cardiovascular system. And so just overall good oral health care, keeping infection, rotting teeth, and periodontal disease, keeping those things healthy, going to the dentist and having regular cleanings, you can keep the ratio of good bacteria to bad bacteria in check, and then you keep from getting an infection. And then those infections create, like I said, inflammation and other immune responses that could really throw your health out of whack.
So yeah, there's a lot of people now kind of talking about oral health and how that can really mess up your hormone regulation. It can obviously, I think a lot of it just stems from the gut. So when your mouth bacteria is off and it kind of leaks into your stomach, and it can cause wreak havoc, especially if you have an infection.
Yeah.
You have infection that's dripping down into your gut, and how that can really jack with the microbiome in your gut. And then all of the other issues, systemic issues that can cause. It feels like there's a lot more people starting to talk about that. One thing that also has been more talked about is root canals themselves.
Yeah.
I don't have a whole lot of information on this, but I'm just curious, what is your opinion of root canals? And maybe educate me on the different ways in which you can fix issues, because maybe explain what is a root canal, what exactly is happening.
Sure.
And then what are the alternatives to getting a root canal?
Yeah.
And what are the potential long-term risks of having a root canal?
Great question. So a root canal is when, we all have natural root canal spaces that are healthy. It's filled with nerves and blood vessels. And a tooth is alive when the tooth is getting the proper nutrients through the blood system to a tooth. A tooth is damaged either through a cavity that eats away, and the rotting tooth gets down into that blood vessel nerve area, and the tooth becomes necrotic or it dies. And then you've got this breeding ground for bacteria to live and survive without the blood vessels being able to attack that infection. So it's, the bacteria's invaded the home, and now it's having a party. Mm. And so a root canal procedure is where they go in and clean out they kick out all the people who've invaded the house, and then they seal off the doors and say, this is no longer a place where bacteria can live. And so when you first have a tooth that goes sick and it's started to become invaded by this bacteria, you might have some symptoms, some swelling, some redness. You bite on it and it hurts a little bit. And that's when a lot of people will go to the dentist. Well, sometimes they'll delay in going to the dentist. Like maybe this is in my mind. Maybe it's really not hurting that bad. And then all of a sudden the pain will go away. And they'll say, I'm fine. I guess it was nothing big. Well, really what happened is the tooth died and there's no nerve endings and all the blood vessels are just rotten. And they go, oh, I guess it took care of itself. But that source of infection of bacteria can just feed into the rest of your body. Well, if you kick the bacteria out and seal off that tooth, then the tooth, even though it's dead, it can still sit in your body and you can still bite and chew. I have one tooth that I have a root canal on, and I could put cold on it all day long and it wouldn't hurt because the nerve is gone, but it's still healthy and it's intact, but it's in my body. Some people hear the idea of you kept a dead tooth in your mouth. That's, the taxidermist just embalmed your tooth and now you're leaving it in your mouth. That's so gross. There's people that say anytime a tooth dies, it should be pulled out and thrown in the trash. And I think that's a little bit extreme. I mean, if I'm going to do everything I can to save the teeth, and I think a well done root canal is great. Now, anything that you put in your body that's artificial, anything, whether it's Botox or lip fillers or the deodorant that we rub under our arms, these are artificial chemicals, and there's risks associated with any chemical that we bring into our mouth. Fluoride. I mean, fluoride is normally a natural in well water, and it makes people's teeth stronger. But there's risks with it. Right now, RFK is talking about red food dyes, and anything we eat or consume that's artificial has risk with it. But back to root canals. If it's done well, the material that's put in it's called gutta percha. And it just seals off any entry to the tooth so that the bacteria can't re-enter it.
And what if it's not done well?
If it's not done well, then either the seal isn't made and the bacteria can still get into that inner chamber of the tooth, and a secondary infection can happen. And so the body will tell you, hey, the party is still happening, the infection is still there. And so a lot of root canals are done by your regular dentist, but if you have that happen, oftentimes the dentist will say, hey, there was something that didn't go well with this root canal. We're going to send you to a root canal specialist, an endodontist, who is going to do it well. And if they do it well and it still doesn't respond well, then oftentimes the tooth needs to come out, and that source of infection needs to be removed from your body, and so that you can get back to wellness.
So what is the worst case scenario if you do not fix an infected tooth?
Oh my gosh. Yeah. So the very worst case scenario is there are patients who their whole face can swell, and it can restrict breathing. People have died from not fixing a cavity. Now, that's super rare. Usually you're going to end up in the emergency room before that. But you shouldn't ignore the symptoms that your body is telling you. My wife and I talk about this a lot. When you have a problem, a medical problem, you shouldn't ignore it. When you have a fever, when you have aches and pains, when you have swelling, your body's actually very smart. It'll tell you when something's going on. The question is are you listening to those cues, and do you know what those cues mean? And are you using a healthcare provider who help guide you to say, hey, this is what that health cue means? And so, when you have a toothache, or you have bad breath, or you have some symptom that's going on, there's something going on there, and seeking the care of somebody who knows that expertise, they'll help you out.
I think this is an important topic because a lot of times the symptoms or the things that people are feeling, they would never relate to their mouth. Yeah. So for instance, a story that I have is we have a close family friend that was coming down to stay with us down here. And one night, like, she was babysitting the kids for us, and we came home, and she's just like, oh, I just feel so sick. And she had a fever, and, she thought maybe she was getting like the flu or something. And she was just in a ton of pain, like her stomach hurt. And we ended up taking her to the emergency room because it was like late at night. The like quick,
Minute
urgent
clinic,
care
yeah.
places were closed. So we took her in, and they checked her out, and they couldn't really figure out why she was feeling those flu-like symptoms. So I think they gave her some stuff to help, like with the symptoms.
Yeah.
She ended up going home. She doesn't live here in Arizona. She ended up going home, and what they found after, it took a little while, but what they found was she had a root canal years prior that they didn't kick all the bad bacteria out, and it was showing up as flu-like symptoms.
Yeah.
Which I thought was crazy. I'm like, what the heck? And this was kind of like the first time I'd heard of something like this. And it made me think, like, there's like a lot of times we just jump to thinking, oh, it's just a virus going around, got a little flu, it's just a cold, sleep it off, you'll be fine. But if you find that something's not going away or it keeps coming back, you might just want to go in and have like really check your mouth.
Totally.
That's probably like the last place I would think, but maybe it's a good place to even like start earlier, is to go have that checked out. Because if you know that you have a history of cavities, or you have a history of root canals or crowns or any of that kind of stuff, they very well could be the culprit for some of these.
Totally.
The way you feel, if you feel off or just not feeling right.
So what's the rest of the story? Did they get it out and everything was?
Yeah, she went and had it like redone, probably by an endodontist, and now she's great.
Good.
Yeah. So
yeah, it's interesting because those things can happen, and like you said, it's all related, and so yeah, just a wellness visit. The other thing that's also interesting is just a little bit back to orthodontics, like respiratory. Like if there's so many kids that have like these ADHD symptoms, and I see a lot of these kids, and I'm looking at their health history, and they're on all kinds of medications to treat the symptoms. But really what's going on is they have an airway problem, apnea. They got these underdeveloped jaws. There's even a correlation between bedwetting. Kids that are apnea, they have a hard time getting oxygen to their brain, and it shows up as bedwetting. So, I mean, just being able to put the connections together on, hey, if I'm not getting the oxygen that I need when I'm sleeping, I'm not going to be well rested. My brain is going to be not working the way that it should. I can't keep my attention or focus. So rather than giving the kid Ritalin, we just need to figure out how to get the kid air. I mean, they just need oxygen. And
that's interesting. Yeah, I never made that connection. But I guess if you look at like the potential side effects of what happens if like your mouth is not right, if the airway is restricted, like then what could happen, and what types of behavioral issues might you see in somebody? So to summarize that, so what you're saying is like if you have a kid that struggles with bedwetting or has behavioral issues, it could be coming from their mouth. So it could be just coming from their airway, the way their mouth is structured, the bone structure of their mouth, which would go back to that wellness check. So if you've got a kid that's struggling with some of these things, because I think there's a ton of parents out there that don't necessarily want to medicate their kids right away. For some kids, medications are life-changing for them for behavioral issues. So I'm certainly not saying that this is, but trying to provide kind of a step-by-step guide of, okay, what do I do first? I think there's so many parents that are dealing with kids that they just don't know how to help them. They don't know the first place to go. You do have wellness clinics and others that are saying, hey, they could be deficient in certain nutrients. They may have certain genetic markers. Mm-hmm. So why don't we check all of that first before you put someone on like a long-term medication? But now you're also saying, maybe a like oral wellness check would also be part of that.
Or even not even your dentist or your orthodontist, but maybe an ENT. I mean, they're specifically helping to make sure we can restore nasal breathing, and you should be breathing through your nose mostly. Mm-hmm. But if you're obstructed, or if you have a family where you have a narrow, everybody in the Curtis family, we've got this narrow nose, mm-hmm. You'd say, well, did we inherit poor breathing, or did we inherit a small opening to our mouth? But an ENT it's another referral that I make a lot, is to check out the airway, and they're the experts in anything behind the mouth.
Yep.
So those are also, the dentist and the ENT can work very closely. Those are the things I would do as a checklist. If my kid had a diagnosis of ADHD or
that's
anything
interesting.
like that.
I think that could help a lot of parents actually to give them another thing to go look into. Because I know there's several in my life that I know of that they're just searching for answers, and that might not be one place they've looked. So I think that's awesome. I'm curious, maybe on the light side of things, what's like, do you have any cool stories? Just like in your field, I'm sure you've seen all sorts of just gnarly mouths or things. Maybe some dentists travel and do humanitarian things or whatever. But curious if like one of the craziest cases that you've had to deal with.
I had one that was just wacky. I mean, probably 19-year-old on meth. Just the whole entire mouth was rotted out. Hadn't seen a dentist ever and just didn't think it was a problem. I'm here for my checkup. Really sad. Mouth tattoos are crazy. There's a lot more mouth tattoos. People
like in your mouth,
inside. They'll go to a tattoo. They don't want it visible, but they'll put stuff on their mouth. One patient said "F you." It's just like and just pull it down. But piercings.
I'm picturing. So when Sam was in there the other day in your office, he had that massive thing in there that's opening his mouth just wide open, so you could put the bottom braces on him, and he just had that right there.
Yeah,
just for you and for your dental assistants. That'd be great.
Yeah, piercings too. I mean, like teeth jewelry that people do. They'll glue a diamond on their tooth. Just some wacky, crazy stuff.
Yeah.
Trauma is sad. I had a patient a couple years ago now. We since fixed her up, but she was riding one of those electric scooters. Big metropolitan cities, you'll get on the scooter, and she tripped and fell. She hit her chin and she broke her jawbone. Her condyles, the joints that connect her jaw to her skull, were completely 90 degrees. So just really bad. She couldn't open, she couldn't bite. So we had to I worked together with an oral surgeon to kind of reconstruct her face. And back to your earlier question about the really rewarding, like when you can help somebody who can't eat, they can't talk, they're having a hard time breathing, and you can like rebuild their face.
Yeah.
It's kind of cool. It's like the extreme makeover mouth edition. Those are really, it's sad, but it's also fun to work as a team with the dentist, the oral surgeon, and the orthodontist. It's cool to help people.
Sad but amazing too, because you're giving them a sense of like themselves again. And I know in some cases you can't restore people back to 100% of where they were, but to get them close, it's almost like a miracle for them. We have, and I'd love to get them on the podcast too, but like we have several family members that have been in just various accidents doing the things they love doing, and they're just accidents, things happen, but have had to have several like reconstructive surgeries, many on their faces, dealing with people like you and other, would it be like is it maxillofacial like surgeons? Is that what they're called?
Might have been a prosthodontist.
Where they're just like these small intricate bones and trying to reconstruct, and to me it's just a miracle, like what modern medicine has been able to do for people, and getting them to restore back to really as close to possible normalcy, because they're tragic. But yeah, I'm sure you've seen a lot of stuff with just various people coming in. So like, I'm curious, we did talk a little bit about accidents there. Are there, you're a fun person, so I know you like to do lots of fun things. So I don't know how restrictive you are with kids and stuff. But if there were maybe 3 activities that you would tell parents, if you want your kid's face to stand a good chance, don't do these 3 things, what would those 3 things be?
Pogo stick.
Okay.
Like, we have one at my house, but
see, I knew you would.
I love it all fun. If it's fun and there's a chance for danger, your kids should be doing it. So let's be clear, like have fun, but just be aware that there's a risk.
So pogo stick's number 1.
Trampoline probably number 2. We have a trampoline as well, but just
You see a lot of those issues.
Yeah. Super, super bad issues. Trying to think next common would probably just be like those electric scooters. Mm-hmm. That one patient, and usually those are mixed with alcohol. So if somebody's like, if you're getting out of the bar and you don't want to drive your car, go get the electric. No, don't do that. Because I've probably had 5 or 6 where I say, all right, how did this happen? And they'll say, oh, it was Friday night. We were downtown and we jumped on the scooters and rock and roll.
You go in those college towns and they're full of those scooters, and I've seen them like tripling up on those things, and I know they're lit up on something.
Yeah.
And they're just flying across the street. Yeah. It looks like a recipe for disaster. But yeah, so you said pogo sticks, trampolines, and scooters. Yeah. I think the scooters and the trampoline for sure. I don't know how many people have pogo sticks. Maybe way more people have those than I know of. We actually had kids over at our house. Last day of school was yesterday, and we had a bunch of just neighborhood kids coming over, and my oldest is going into high school next year, and he had a couple of his buddies on the trampoline, and our tramp, gets 110 plus here for a long time. Yeah. After a couple of years, those tramps start to get a little weak, and they went through my tramp yesterday. Like,
everybody
no joke.
Okay?
They're actually okay, but they were just jumping, and all of a sudden these 2 big kids just sunk right through, and they ended up on I was worried one was going to break his ankle. But trampolines, it took me a while to get one, because I'm kind of that same way where I'm just kind of like, I don't know, like, because I grew up on them as well, but I don't know why I was hesitant, but we ended up getting one. But I've seen a lot of people get hurt on trampolines. So,
but stuff happens.
Yeah. Stuff happens.
Yeah. But really, sports, I mean, there are a lot of leagues that do require mouth guards, and like, hey, you can't play flag football if you don't have a mouth guard.
They just chew on them though.
Yeah.
They don't even wear them.
And there's some crappy ones out there. But I think the league is to be commended for like at least trying. But then I'm surprised that more basketball and soccer don't require your kids play soccer, right? Mm-hmm. Do you see kids with mouth guards in the soccer field or not?
No, I never have.
But it's pretty ruthless, right? I mean, they're contact, slide tackling. And so, and it also depends on what's going on in your kid's mouth. If they're developing normally, they're not really going to be that prone to mouth injuries or jaw injuries unless it's a concussion. But some problems where the kids are sucking on their fingers and thumbs and their teeth stick out. Like the joke is they could eat corn on the cob through a fence. I mean, their teeth stick out so far that those kids, if they're taking a brisk walk, they should be wearing a mouth guard. I'm not going to say they need to wear a mouth guard when they're on the swim team, but if they're playing basketball or volleyball, under the hoop, you're going to get an elbow. And so if you have an orthodontic problem where your teeth stick out a lot, you should be wearing a mouth guard, even if you're the only kid on the whole pitch that's wearing a mouth guard.
You still do it.
You still do it.
So I grew up playing soccer, and we were at practice one time. We used to practice at the one of the high schools where I grew up, and I took a little friendly fire from one of the defenders on our team. I don't know if we were scrimmaging or something, but my buddy Tony Allred, he's just a beast. Like, he was just a big kid. He was strong. He could kick the ball really hard. And I remember I took a ball right to the face on the side though. So it hit my jaw and like pushed my jaw sideways. And I feel like it's really weird. And this kind of goes back to maybe how like the jaw, I don't know, but like I was biting down crooked for days.
Yeah.
I didn't go get checked. Should have. But I was biting down and my bite was off for a couple of days, and it slowly worked its way back.
Yeah.
And I had like a ton of pain in my ear. But I think I have long-term kind of like, if I open up really wide, it'll kind of like click to the side. And I think it's from that day.
Yeah.
I don't know.
But you remember it.
Oh, I remember how bad that hurt, because your jaw, there's so many nerves in there. And I just remember like how bad that hurt and then how awkward that was. So that's one thing that I had growing up, and I don't know if there's anything that could have been done about kind of stretching that out. I think the maybe the muscles and ligaments in there just like stretched, and then they just kind of worked their way back until it healed. But
the body is amazing. I mean, it will try to heal itself in the vast majority of things, like you described. You know, inflamed for a while, it kind of went back, but it never quite the same. But the body is amazing in that way. But
it was after I had braces too, and headgear I had to wear at night.
Do you have pictures of your headgear?
I need to try to find it.
Say, Mom, can
I never had to wear it during the day, fortunately, but it was like that, the one that like had the thing that went behind your head and like the little. Yeah. Do you still do those? None of my kids had those.
No.
You got all this new
what
technology.
Keller had, the spring in his mouth was the modern equivalent of headgear. And it's just the reality is that anything that you ask a kid to do these days is much harder to get them to comply with a regimen of, scoliosis braces. And I don't know what other things we have kids do, but to get a kid to cooperate and have a parent want to enforce making them do it, it's just a lot harder.
So this podcast is all about really trying to help people live long, happy lives, right? And this is part of it, like the mouth and taking care of your oral health and how that affects everything else. What advice would you have for parents out there who are trying to optimize their health, and how taking care of just oral health, their kids' oral health, what advice would you have for them on kind of best practices on how to do that?
Yeah. I mean, we've talked about some of them already, but just get a relationship with a team of dentists in a kid's life from birth to when you kick them out of your house. They should have a pediatric dentist that they should start seeing 2 or 3 years old. Just get a checkup, make sure that they've got some good habits. They should then transition to a dentist, just a regular dentist that mom and dad also see, and get checkups and cleanings. It's recommended that people see the dentist twice a year. And I think that that's great. I mean, I think seeing the dentist twice a year is a great thing. See an orthodontist, have a relationship with an orthodontist, and, make sure that the mouth is proper for digestion and breathing, but cosmetic as well. But, and then when they get a little older, maybe have an oral surgeon that looks at wisdom teeth to see if their wisdom teeth need to come out. But if you invest in just normal health development of your mouth, having some professionals that you have a relationship with, that you trust, and just kind of have the wellness checkups and follow up, they're gonna leave the parent's household having been well taken care of, and hopefully they've developed some good home care habits at along. If you do that, if you see a pediatrician, see an orthodontist, have a dentist and an oral surgeon, if you've done that with all of your kids, how many kids do you have? I should know this.
Just 5.
Just 5. Okay. But with your 5 kids, if they've kind of, see Dr. Banks and see Dr. Curtis, and, if they kind of go through that, they're going to have really great, amazing teeth when you kick them out of the house at 18. There used to be a time in America where everyone got dentures. Everybody ended up with dentures at 60 or 70 or 80. And it's awesome now. That almost never happens. But if you can have a whole set of teeth until you die, that's totally doable. And it will pay its rewards. I have a good friend, he's a dentist, and he says his biggest motivator for people is, he says, what do you want chewing and eating to be like when you're 60? And he asks that question, and then they'll respond, I want to be able to eat a good steak, and I want to be able to enjoy myself. And they say, all right, well, where you are at now, you're not going to be there. But if you do X, Y, and Z, we can achieve that for you. And then I think that if you establish that with your kids, hopefully they establish that with their kids, and then it's just, this is what we do. We go to the dentist. Dentist isn't somewhere where we go when we're in pain. This is somewhere where we go to, it's like going to the gym. I don't know if your parents went to the gym when you were growing up. My parents never went to the gym, but people our age, everybody has some type of fitness routine, and we've changed that in a society. My wife and I were also talking about drinking water. Like when we were kids, we never walked around with a jug of water. And I think, we're changing things and changing them for the better. So
I think as humans, sometimes we have a tough time looking past just today and like really that investment mentality that you and I were talking about before we started. And one thing that I say almost on every podcast is just kind of the work you put in today is not necessarily so that you look great today or you feel great today. That's a big part of it. But what you're doing is you're building up like this armor. You talked about the gym, the muscle that you're building right now today. Really the big part of that is so it's there for you when you are in your 50s, 60s, 70s, 80s down the road. Because you can still build muscle, but it just gets so much harder.
Yeah.
But you're really just preparing yourself for a time that you're really going to lean on it and need it.
Totally.
And the same can be said about your mouth, right? It really, the daily routines, the brushing in the morning, the flossing, brushing at night, avoiding the sugary beverages, avoiding all this, candy and all these things that give you kind of that short term. Like if you can help not just ourselves, our kids are going to watch what we're doing. So we better have good oral hygiene habits.
Right.
But if we can show our kids, I never thought of it like that as far as like teeth falling out. But I mean, my grandfather, he started like, he got into his 80s and it was like, like he'd start missing teeth, one would fall out and, and some of it had to do with he had really bad dry mouth. I think that had something to do with it. It really like was hard for his oral health just got bad. Some of the medications he was on and stuff. But to your point, it's like, if you want to, like, what do you want chewing to be like when you're in your 70s?
Yeah.
You got to think about that today.
Yeah.
Right. And so it is an investment. It's how are you spending your time? Just the daily small little things you can do every single day to make sure that you've got, those healthy habits in place so that your teeth are there when you need them the most down the road. Because right now I think we just take it for granted, right? I got a mouthful of teeth and I can eat steak.
I'm good.
But one day it might not be that simple. So anyway, I appreciate you coming on. I think this is a super interesting topic, especially as it plays into the role of like metabolic function, metabolic disease. There's so much more we didn't even tap into yet. Neurological health, hormone health, all of that. But the mouth is so important. It really is kind of the first gateway of bacteria, right?
Yeah.
And like the bacteria you allow in your mouth, there's good and bad. And if you're not getting rid of the bad, it's making its way in and it's part of your system.
Right.
So it really is kind of that first line of defense with our bodies. And so,
well, it's great of you to get the message out. I mean, I think it's amazing what you're doing.
Well, and I know that you mentioned you might do a podcast.
Yeah.
So when you do, let me know.
Okay.
But until that time comes, I know you also have some content you guys put out there. I know you're constantly trying to educate people.
Yeah.
But I know those that are local in like the Gilbert, Arizona area can find you. What's the best way to reach you guys? Your website?
Our website, Curtis Ortho AZ. Just check us out there. We have a location in Tempe Chandler area. And then we have another one out here in Gilbert.
And then what about some of the stuff you've put out around like, I know you have some social media stuff that you've been putting out too.
Yeah. So Curtis Ortho AZ is our Instagram handle. Okay. We have a YouTube channel as well. And we're just, we put out some how social media is. We're trying to do some that's educational, some of it's funny and, but yeah, we'd love to connect with families here locally.
Sweet. Very good. Well, thanks for coming in, man. I appreciate it.
Having me on.
All right. Take care.